It's been weeks, months, maybe years of battling addiction. All that's left now is rock bottom. And when that happens, oftentimes that person who has seemed to lose all hope is ready for help.
But what does that help look like? Maybe a safe space, one that offers therapy in an obviously sober setting. Well, our next guest is part of a program that offers all of that and more.
We'd like to introduce you to the CEO of Connexio Care, Inc. and Coras Wellness and Behavioral Health, Lynn Kovich. Lynn, thank you so much for being here.
Thank you for having me.
So before we get into opioid treatment programs, help us understand that moment when a person finally realizes and reaches out for that help.
The system has to be ready to go and ready to accept them into treatment, because it is a very short window when someone is ready to accept treatment. So the system has to be ready to adapt and get them into the right level of care and the right services.
Okay, so as far as the person's concerned, are they the ones that need to make the decision, I need help now? I mean, you've got forceful friends, you've got forceful family who are trying to do the best they can. Is that always good?
Ultimately, it comes down to the person and their readiness for change and their readiness to accept the help.
Tell us, what is involved in opioid treatment?
Well, you know, we have come a long way in using medication for opioid treatment and using medication-assisted treatment, something like methadone or Suboxone, but it's a combination of medication with counseling. It's not one or the other. We have found that methadone, Suboxone, the medication is something that keeps someone really on the road to recovery, coupled with treatment, coupled with housing, coupled with a job. You know, it's not just one linear thing for someone in recovery. It really is a whole host of services. The first thing being really the medication and the counseling.
So this sounds like, and correct me if I'm wrong, this sounds like something that's not a one way to do it for everybody. You kind of have to customize it for each person.
Everybody's treatment plan is different, everyone's needs are different, everyone's level of care is different. So the system is really meant to be person-centered and focus on that particular person's needs, coming from a strength-based position for the person.
All right, so we know that it's not an easy undertaking, but you've seen people do it. Anything you can share?
I was just at an event last Monday at an opening of our newest clinic in Claymont, Delaware, and we had an individual speak who completed our program and now works for us as a peer.
Really?
That's incredible. That has to make you feel good.
That's why we do it.
That's why you do
That
it.
And
is
it's
awesome.
I always approach it as one life at a time.
One life at a time.
CEO of Connexio Care and Coras, Lynn Kovich, thank you so much.
Thank you guys so much for doing this.